one victim in there, what are you going to do?
If you find one person lying on the somewhere lifeless, just go and check near the person and check first the environment if it is safe. Then go to the person and check for responsiveness by shaking it gently. Are you okay? If there's no response, shout for help. Then try to listen for breathing by bringing your face near to the patient's nostril to hear for breathing sound. And if you cannot feel any breath sounds, open the airway by lifting, holding the ear under the jaw with the left hand on the forehead, not so extended so the air will come in.
So it's look, listen, feel,
And then
for not more than 10 seconds. And when I say it's not look that you can feel, you have to look to see that the chest is rising, and you listen by putting your ear
near
by the mouth,
yeah.
okay? And feeling, you put your hand over the mouth to see if you've got any humidity going, okay. So we have look, listen, we check the breathing, mouthy breathing.
The
What are you
breathing,
going to do?
we will give 2 breaths slowly, 2 breaths. By keeping the hands on the forehead to keep the air away,
Okay.
with the hands under the jaw to keep the position of the head. 2 blows. Then check for pulse at the
Remember
group.
to block the nose, okay? In a child, you don't need to block the nose, but in an adult. I'm just telling you, in this stage of my life, I will not do mouth-to-mouth resuscitation on anyone, okay?
Yes.
When you think about cardiac compressions, there's enough literature, scientific literature to support when the chest is going up and down, there is a passive recoil of the lungs and some passive breathing carries on, because if you think you're compressing the chest, the air comes out. When you let it go, it sucks in. So your most important things, and the new guidelines have come out, get on that chest. And we're in a hospital situation, so never ever I want to hear anyone has done mouth-to-mouth ventilations, okay?
Yes.
And if you're out in the street and you don't know the person, sorry, I only give mouth-to-mouth to my parents, my lover, or my husband, or my children. So you cannot risk your life for that sort of thing, and we're not really worried about it in advanced ACLS. So if you wanted to give 2 breaths and you were in the hospital, you would use the ambu bag, eh? Okay. And that's how it goes. So far, perfect. So you're checking for carotid pulse.
By feeling it on the group of the neck.
Okay? And practice on yourselves, eh? Feel for your carotids, feel for your arteries, practice always on yourself. And if you don't feel circulation, what you're going to do?
If you did not feel for any circulation, you can proceed with the compression.
Correct.
And if there is there is pulse, you can just give rescue breath for the
Correct. Now, what if when you say, if there's a pulse, say there's a pulse of 40, will you do CPR? Pulse of 40?
No.
Yes.
Yes.
40 is your standard baseline for bradycardia, okay? They say you cannot perfuse, but obviously if it's an athlete, you're not going to jump on the athlete's chest, because some of the athletes have a pulse. So if it looks like a gorgeous hunk cyclist or gymnast, you're not going to jump on the chest and say, hey, it's 40. You've got to look at your patient. Remember, extremes of age, fitness, and certain cardiac syndromes. Okay, so 40 you've got to get on the chest.
Compression.
Okay, so now tell me about the compressions.
To locate the proper place for the hand,
Yes?
we should check for the nipples.
Yes, but now if you look at my nipples, you're going to be down here.
No.
Okay, so You just stop, you just take the top of me, the bottom of me, okay?